Why do doctors sometimes confuse us? These days, things can feel a bit strange. Many doctors urge people to lower their blood pressure, even when it's perfectly normal for their age. For example, if you're 30, a reading of 120/70 is ideal, almost like the gold standard for astronauts. But once you hit 45 or 50, numbers like 130/80 or even 140/90 become your new normal. Here's the key. For older adults, these readings aren't a disease. They're just how the body works. Sure, keeping your pressure at 120/70 forever would be great. But let's be real, that's more of a dream than reality. So if you're 55 or 60 and your monitor shows 135/85, relax, that's normal. When should you worry? So when should you take action? If your blood pressure climbs above 140/90 and keeps rising, it's time to pay attention. It's especially serious if it spikes to 170, 180, or higher. These jumps put your heart, blood vessels, and brain at risk. What to do in an emergency? Imagine your pressure suddenly shoots up to 180 or even 200. That's not just uncomfortable, it's dangerous. In moments like these, fast-acting medications can be a lifesaver. One go-to option is nifedipine, often sold as Corinfor. Pop half a tablet under your tongue, and within 15-30 minutes, your pressure should start to drop. If it doesn't, you can try another half. For some, moxonidine, like Physiotense, works better. It's gentle but effective and great to have on hand for emergencies. Then there's captopril, or Capoten, which is milder but reliable, especially when placed under the tongue. These drugs are for emergencies only, not daily use. They're your safety net when the numbers on your monitor get scary. What if your pressure is just slightly high? Sometimes your readings are a bit above normal but not at crisis levels. What then? Try these simple, safe methods. Valerian. 4 to 5 tablets can calm you down and gently lower your pressure. Hawthorn tincture. Mix a teaspoon in half a glass of water for a soothing effect. Breathing exercises. Check out our videos like 3 breaths for blood pressure or 1 breath for anxiety. They've helped thousands feel better fast. These work best when your pressure is mildly elevated, not at dangerous levels. Simple steps without pills. Sometimes pressure spikes out of nowhere. You were feeling fine, but suddenly the numbers creep up. Here's the thing. Not every rise calls for medication. Your body often just needs a little nudge to find balance. Stress is a big culprit. When you're angry, anxious, or scared, your heart races, your vessels tighten, and your pressure climbs. The first step? Calm down. Valerian is old school but effective. Just 4 to 5 tablets can relax your nerves, and your pressure may ease on its own. No harsh drops, no side effects. Another time-tested remedy is Hawthorn tincture. A teaspoon in half a glass of water can steady your heartbeat and ease stress-related spikes. Then there's breathing exercises. They're free, simple, and take just a couple of minutes. Inhale deeply, hold for a moment, then exhale slowly, longer than your inhale. Repeat a few times and you'll feel your body unwind. Blood gets more oxygen, muscles relax, and vessels open up, lowering your pressure naturally. These techniques shine when your readings are moderate, like 150/90. For severe spikes like 180/200, you'll need stronger measures. But for milder cases, they're a game changer. Studies show breathing exercises help not just with pressure, but also anxiety, insomnia, and even panic attacks. They're a tool everyone should have in their pocket. So if your pressure is slightly up, don't rush for pills. Try calming down, breathing deeply, sipping Hawthorn, or taking Valerian. Only if it keeps climbing should you turn to stronger options. Your body's secret weapon: massage and movement. Ever wonder why your pressure spikes for no obvious reason? You didn't eat salty food, stress out, or drink coffee, yet the numbers climb. The culprit might be your body itself, specifically tense neck muscles. When your neck is tight or spasming, it disrupts blood flow, forcing your brain and heart to overwork. The result? Higher pressure. But here's the good news. You can fix this without pills. Neck exercises. Just 10-15 minutes of gentle movements can work wonders. Try slow head tilts forward and back, smooth turns side to side, or soft circular motions. These ease tension and free up your blood vessels. Many people see their pressure drop 10 to 15 points after this. One tip: always check your pressure before and after. For most, it lowers, but for a few, it might rise slightly. Test it carefully, and if it works, make it a habit. Ear massage. It sounds odd, but it's effective. In Eastern medicine, your ears are packed with active points tied to your nervous system. A few minutes of rubbing your ears and earlobes can relax your vessels and bring your pressure down. You can do this anywhere, home, work, or even on the bus. The relaxation key. For the best results, pair these with slow, steady breathing. It amplifies the effect. Don't dismiss these methods as too simple. They're often the most powerful. So ear massage and neck exercises are your allies against high pressure. They won't replace emergency meds, but are perfect for everyday control. Water, salt, and movement, surprising helpers. Sometimes, lowering pressure doesn't require fancy solutions. Your body can relax if you give it the right conditions. One of the oldest tricks? Water. Salt bath. Picture this, a warm bath, 37 to 38 degrees C, with a few tablespoons of regular table salt dissolved in it. Soak for 10-15 minutes, and something magical happens. The salt eases tension, the warmth opens your vessels, and your heart calms down. Many see their pressure drop within 30 minutes. How much salt? About 5 to 10 tablespoons for a standard tub. Afterward, wrap up in a blanket and rest. People often say they not only lower their pressure, but sleep better too. Brisk walk. Another great option is a quick walk. When stress spikes your pressure, 20 to 30 minutes of fast-paced walking can work wonders. It boosts blood flow, oxygenates your tissues, and melts away tension. You'll feel clearer, calmer, and your numbers will often ease back to normal. A word of caution. Walking isn't for everyone. If you have joint pain, it might be tough. But there's a workaround. Try gentle knee or hip exercises. They improve circulation and can help lower pressure without strain. Why it works. It's simple. Relaxation, whether from a bath or a walk, stops your nervous system from clamping down on your vessels. They widen, blood flows freely, and your heart eases up. Best of all, these methods are safe and can become part of your routine with no side effects. Sunlight and silence. Unexpected allies. Sometimes the best solutions are right in front of us. We often think pills or strict diets are the only way to manage pressure, but nature has its own tools, sunlight and silence. The power of sunlight. Ever notice how you feel lighter and happier on sunny days? Science backs this up. UV rays trigger your skin to produce compounds that relax your blood vessels, lowering pressure. That's why people in sunny climates tend to have fewer blood pressure issues than those in darker northern regions. If you live where sunshine is rare, make the most of clear days. In winter, short sessions in a tanning bed can help, just don't overdo it. It's a simple way to support your body. Floating. A capsule of calm. Here's something cutting edge. Floating. Picture a pod filled with warm, salty water matching your body temperature. You lie inside, the lid closes, and you're enveloped in silence and darkness. No sounds, no lights, just weightlessness. This is called sensory deprivation, originally used by astronauts to recover from stress. Now it's available in many cities. Your body fully relaxes, muscles release, and your nervous system resets. Your pressure drops naturally, and the effects can last for days. Is it accessible? Floating isn't the cheapest option, but even one session a month can make a difference. For those looking for modern, unique ways to stay healthy, it's worth exploring. Sunlight and silence aren't magic. They're real, powerful tools to manage pressure. Don't underestimate the simple things. They often pack the biggest punch. The hidden power of food, the dairy plant diet. We often overlook how much our diet affects our blood pressure. Food can be medicine or poison. To keep your pressure stable long-term, not just for a few hours, start with what's on your plate. Why food matters. It's straightforward. Salty, fatty, fried foods make your vessels tighten and stress your body. The more salt and processed food you eat, the harder your heart works. But vegetables, dairy, and whole grains help your vessels relax and function smoothly. Doctors have long noticed that people who eat mostly plant-based foods have lower rates of hypertension. What's the dairy plant diet? It's simple. Focus on vegetables, fruits, dairy, whole grains, and lean meats like chicken or turkey. For fish, stick to low-fat options. Cut back on fried, salty, or fatty foods as much as you can. Standout choices include oats, buckwheat, or rice, whole grain bread, fresh fruits and veggies, low-fat cottage cheese, yogurt, or kefir cook meat or poultry by steaming or boiling, and trim off fat. The golden rule? Less salt, lower pressure. Just halving your salt intake can lead to noticeable improvements in a few weeks. Lasting results. This diet isn't a quick fix. It changes how your body works. Your vessels become more elastic, your heart calms down, and your metabolism balances out. Many find that after a month on this diet, their pressure stabilizes to the point where they need fewer pills. A little trick. For an extra boost, add more greens like parsley, dill, or spinach. They're rich in potassium and magnesium, which support your heart and vessels. The dairy plant diet isn't a temporary fad. It's a lifestyle that can transform your health. Your pressure stabilizes gently, and your body feels better overall. When to act fast, when to stay calm. We've covered tons of ways to manage blood pressure, from emergency pills to breathing, salt baths, and diet. But how do you know which to choose? Here's the rule: assess the situation. Emergencies. If your pressure spikes to 180, 200 or higher, or you feel dizzy, nauseous, weak, or hear ringing in your ears, act fast. Use emergency meds like nifedipine, moxonidine, or captopril. Place them under your tongue and wait 15-20 minutes. This is like putting out a fire. Deal with the crisis first. Mild elevations. If your pressure is moderately high, like 140, 150, 90, don't panic. Try gentle methods: breathing, hawthorn, valerian, a walk, or a salt bath. These can often work just as well without stressing your body. Long-term strategy. To keep pressure from becoming a constant issue, think long-term. The dairy plant diet with minimal salt is your foundation. Add regular walks, neck exercises, sunlight, or even floating. Together, these can keep your pressure steady without relying on pills. Balance is key. The goal isn't to crash your pressure, but to manage it. When you know what works for you, you gain confidence and calm. And that calm itself helps keep your numbers in check. Final thoughts. Friends, you now have a toolbox full of ways to tackle high blood pressure, beyond just pills. Try these methods, find what fits you, and take control of your health. If this was helpful, please support our channel. Subscribe to catch our latest tips. Like this video if you want more practical advice. Comment below. What pressure-lowering methods have you tried, and what worked best for you? Your experience could help someone else. Stay healthy, take care, and we'll see you next time.